it's such an important part of being a physician leader to understand healthcare policy, because you work with the regulations and the legal implications of healthcare as such a highly regulated industry all the time when you're a physician leader. And in order for Kelley School Business of Medicine program to adequately prepare our physician leaders, they need to understand not only an understanding of the current laws, but how policy is made, how they can be involved in the conversation and inject in the conversation around healthcare policy the unique perspective they have.
I think as a physician, we often find ourselves very busy and very much involved in the daily activities of providing medical care for our patients. And we don't get involved with all the other stuff that affects us, such as legislation and stuff from Washington that actually kind of guides everything we do indirectly.
It's been a really interesting journey, starting with how a bill gets turned into law, all the way to telemedicine, interacting with our government officials. As physicians, we are all trained to deal with our patients on a one-to-one level. But being here this week, it's really given me a different insight into how I can impact several thousands of patients rather than just the one-on-one in ways that I never really considered before. It's also given me a good perspective on how we as doctors can collaborate with one another to affect change, which I don't think we really think about.
I think what I've learned this week is how important it is for physicians to have a voice so that they can be heard, because lawmakers know about the law, they don't really know about healthcare. And I think it's vitally important for physicians to educate the lawmakers about healthcare, the challenges that we face, as well as the challenges that our patients face as well.